a lot of people, everybody has been given a diagnosis, but a lot of the times that diagnosis is not the diagnosis of the pain generator. So something that just continually comes up over and over and over again in clinical practice with the potential patients I talk to, the patients I talk to, people on social media, is this lack of true diagnosis of a pain generator. And now a lot of people, everybody has been given a diagnosis, but a lot of the times that diagnosis is not the diagnosis of the pain generator. It's the diagnosis of a structural change. And those two things can be massively, massively different. Now, there are some times where those things match up, right? Patient has knee pain and they had an injury that's consistent with a meniscus-like injury. And then they have meniscus pain. So the pain that they have is very classic characteristic of a meniscus. And then you get an MRI and it shows a meniscus tear. Those things match up. But just because you have an image finding doesn't mean that that's actually going to cause your pain. Put another way is that structural changes do not always equal pain. And so a lot of people end up walking around saying, oh, I have degenerative disc disease. Oh, I have a pinched nerve. Oh, I have a meniscus tear. Oh, I have a labral tear. But they've had therapies for those things. They've had treatments, injections, maybe even surgery, and they haven't seen any results, or they've gotten worse, or they've only gotten a little bit better. And in those situations, there is a disconnect between these structural changes found on an MRI, a CT, an X-ray, versus what the patient is actually experiencing in terms of pain. Part of the reason that this can happen is, when you start looking into the healthcare system and the insurance side, is a lot of procedures, so injections and surgeries, are approved based on image findings. And so that right there is a huge, huge issue, because if you have physicians who the way that they do what they do is by diagnosing based off imaging, then they're going to rely a lot on imaging and less on the physical exam, because if they only rely on the physical exam and not the imaging, then the insurance company is not going to approve a particular therapy because the insurance company doesn't have enough evidence to do so. And so I really want to start bringing it back to this concept on, we have to start getting back to doing appropriate physical exams that are there to elicit chronic pain. There's orthopedic, neurological, musculoskeletal exams, movements that we can do to the patient or that the patient can do themselves in office that help to elicit what structures might be causing pain. Now, there's a lot of art to this. There's obviously a lot of science behind these types of orthopedic, neurological, physical exams, but taking that information and melding it into what is our clinical diagnosis on what structures are causing patients pain, there is a bit of an art to it. And I think that art has really been lost with a lot of doctors. And again, I think it just goes back to this reliance on imaging. So if you've been told that you have degenerative disc disease and that is causing your low back pain, and that was only diagnosed based off imaging, I strongly encourage you to question that diagnosis, because it was just made off of imaging. If there was no very thorough physical exam designed to actually elicit your pain to determine what structures might be causing you pain. If you have been given a diagnosis such as degenerative disc disease and you've had treatments for that degenerative disc disease, or let's put it another way, you've had a diagnosis of a supraspinatus tear and you have had treatments for a supraspinatus tear, injection, surgery, whatever it is, and you are not any better, it likely means that diagnosis, the diagnosis made on imaging, was incorrect. Yes, you had those structural changes, but no, they were not actually contributing to your pain or contributing a significant amount enough that it would actually cause a change in your symptoms when it is addressed with whatever therapies you have. So please stop relying on just imaging for your pain, because a lot of the times it does not match up clinically what's actually going on with your pain generator. And that's a big deal, because treatments need to be based on what symptoms you have, not just what MRI findings you have.